computer and post it. Okay.
Okay. All right. Hi, everyone. I'm Jess Johnson. I'm one of the veterinarians that works at Luvin Arms. I work with the livestock animals, so with the with the cattle, the sheep, goats, llama, pigs, and yeah, that's everybody that I work with. So I made this presentation on ruminant health and a couple points on first aid, and it's primarily targeted for the care team. So I know some of you guys are there live, so please interrupt me if you guys think of any questions or if I can explain anything further, or you can also ask me afterwards. And then for anyone else, if you think of any questions, my email is right here if you want to get in touch with me. And my practice is Mountain Rose Veterinary Services. This is an outline of what we're going to cover today. So we're going to go over a little bit of parasites, urinary stones, gastrointestinal health, arthritis, a couple things just on llamas that are specific to them, and then we'll touch on first aid. We are not going to cover reproductive diseases and neonatal diseases, so the diseases of the very young, since we are not in the business of getting these animals to reproduce, and we don't also have a lot of really young animals, so I just didn't think it was worth going into that for this presentation. That's a little picture of Teddy and Finn when they were youngsters and just arrived at the sanctuary. So what is a ruminant? Per the dictionary, a ruminant is an herbivorous, even-toed, hoofed mammal that has a complex 3 or 4 chambered stomach. So these are the residents that we're talking about today. I mean, these aren't their actual pictures, but these are the animals. So a llama, which is a camelid, related to alpacas and camels. They have a 3-chambered stomach. And then sheep, goats, and cattle, which are in the 4-chambered stomach group. Fun fact, ruminants do not have upper incisors or the front teeth on top. They have a dental pad there instead. This allows them to gather large amounts of plant material as they're grazing. So it is nice to know, because if you put your fingers in the front part of their mouth, you can't be bitten, or at least, you won't be hurt. However, if you put your fingers in the way back of their mouth, they do have molars on the top and the bottom, and they will be able to bite you there. So we'll start out talking about external parasites, or who I like to call the creepy crawlers: flies, ticks, lice, and mites. So flies, flies are definitely, I always think of them as a problem as a veterinarian. However, I know if I were speaking to an entomologist friend, I know flies do a lot of good things and they're a very important part of our ecosystem. A lot of other animals depend on them as a source of food, and I know they help decompose matter, but for livestock animals in general, they do create a lot of problems. So first and foremost, they're definitely an irritation, both to us who are working at the sanctuary and also an irritation to the animals. You can watch these animals as they try to relax and chew their cud in the summer months, that they're swatting or they're twitching their skin to try to get these flies away from them. They can create sores, or they can go in areas where there's broken skin and make sores bigger. They spread diseases, and then their larvae, or their eggs, can also migrate into the skin and airways and intestinal tract, which causes its own set of scary diseases. Fly prevention, really #1 thing comes down to cleanliness. So manure management, whether that's getting rid of manure off of the property, or a lot of places will do certain level of manure spreading, where you spread it out in such a way that it dries out per a certain number of acres to reduce the number of flies. General barn cleanliness, so sweeping up, not leaving like the food bowls that we feed the kind of sloppy mush to the pigs, like not leaving those out, that can be a big attractant for flies. Cleaning up straw, shavings, all those things. Like the cleaner the area, the less flies you're going to have. And then there are ways to both prevent and get rid of flies. So fly predators, they're a type of larvae that you sprinkle onto the manure piles, and basically those predators hatch and they eat the fly larvae before they're able to turn into flies. So this is used really commonly on horse farms, and I did look into it a little bit. I remember Chartrina asked this before, like, well, aren't there risks associated with introducing another being into your ecosystem? And from what I did read briefly, these fly predators have a really short life cycle, so they aren't able to disrupt the ecosystem. So it's one thing to consider fly traps, and then, kind of making the flies not want to go near the animals with fly repellents, or there's long acting pour-ons that you can use for the cattle, that you kind of pour like an oily liquid along their back, and it will help repel flies and mosquitoes for some time. Ticks. So ticks are a problem. Luckily, because of where the sanctuary is, we don't have as much of a risk of ticks, but still there's always the risk that one of us acts as a fomite and we go hiking somewhere in the foothills and then we bring ticks back, or in areas where there are shrubs and trees, there could be ticks in those areas. So they're mostly an irritation, but also a risk because they can spread some diseases between people and animals. Of these diseases, luckily, Ehrlichia, Babesia, and Anaplasma are not endemic to the Front Range of Colorado. However, we do see some cases of tick paralysis. So it is possible to get diseases from ticks where we live. Ticks have 8 legs, and we know that they get really chubby looking when they are sucking blood from an animal. So that's kind of one way that you'll know who they are, is counting the number of legs and then looking for that little puffy body. Lice. Lice are definitely a nuisance, very common in the winter months because lice like to hide in the thicker, fluffier hair of the animals during the winter time. They are species specific, so cow lice only affects cows, sheep lice only affects sheep. So we can't get lice from a cow and they can't get lice from us. Lice will cause them to be really itchy. If they have the biting lice, it can cause blood loss and anemia. You'll see hair loss, and then animals with really heavy lice infestations may also show signs of poor appetite because they just don't feel well. That's when they have a really, really heavy lice infection. Mites are another type of parasite that causes animals to be itchy, like lice. Lice you can see you can see in the skin. I'll go back to this. So if you have an animal that you're suspicious has lice, if you part the hair, you'll not only see like flakes of dandruff, but if you look really closely, you'll sometimes see things move. So it is visible to the naked eye, though it does require somewhat of a trained eye to kind of look and for the animal to be really still for you to see things moving. Sometimes you can see the nits, which are the darker colored eggs. However, mites are not visible to the naked eye. To see a mite, you would have to look at a piece of skin or like some of the flakes of skin that are falling off under the microscope. Animals with mites will be even itchier, and their skin, not only are they losing hair, but their skin then becomes really thickened and crusty. Animals that normally have like smooth, thinner skin will get really almost like elephant skin, like that thicker gray, scalier look. And they can be very contagious, though I will say I frequently see one animal in a herd or in a flock affected. There could be like 5 goats and only 1 goat will have mites. And I think that's because there's some individual component of that animal's immune system or that animal's more stressed. So even though it's highly contagious, you can still just see one animal with mites. Now for internal parasites. So these are mostly we're just going to focus on parasites of the digestive tract, which are usually, pretty much most cases, spread the fecal oral route. So they're shed in animals' poop, and then another animal eats off the ground where that poop was, and then they're ingested, and then the life cycle continues. Roundworms are a big worm in all ruminants that we worry about. Clinical signs that one of these animals might have a roundworm would be diarrhea, poor growth. These animals might be coughing, and that's because the life cycle of one of the types of worms could be going through the lungs. Anemia, because they cause blood loss, and bottle jaw, which is swelling below the neck, secondary to protein loss. This is one of the big parasites that we worry about in small ruminants, so sheep and goats. It lives in the abomasum, which is the true stomach, and there it sucks blood. And the reason it's such a big problem is because it's a very efficient worm. So one female lays 5,000 eggs per day. So you can imagine how easy that is to just spread that all over the pasture. This is just showing kind of a rough outline of the life cycle of these parasites. So they're shed in the feces, and then the larvae develop in the environment, in the grass, within the poop. And then they kind of go through the different phases, and they turn into the infective stage, which is the L3 larvae. And then that is ingested by another animal, which then is completing the life cycle, which is why ideally we feed up in feeders and not off the floor, though grazing is also part of these animals' natural lifestyle. So, that's why we want manure management and not having overcrowding of animals grazing on one pasture. Many parasites can survive as eggs on pastures for months to years, so they're very hardy. This is just an example of that anemia that you can see. So some of you guys have probably seen me do this, where I check the eyes to check their color, and you want them to be nice and pink. And this animal up top, the membranes of the eye there are really white. And then this goat on the bottom is showing what bottle jaw looks like. So when they are losing protein secondary to having a high load of parasites, they will develop this edema underneath their jaw, which is called bottle jaw. And if we were to push our finger into that swelling, it would be like pushing our finger into like a memory foam mattress. There'll be like an indent that stays there for a couple seconds before it fills back out. So prevention of parasites, sanitation, so keeping our areas clean and not overcrowded. So like one thing I see that's frequently a problem to farms that I visit is they'll have a water trough in the middle of a pasture that's surrounded by mud, and then there's a big pile of hay next to it. So all the animals are drinking, they're spilling water off, it's creating this moist environment, then they're eating their hay there, and they're pooping in the same area. So it's just creating this perfect way for them to become continuously infected with more parasites. Not overcrowding or overgrazing, trying to provide browse for goats, or in our case, we put the hay up in the feeders or in the bags so that they have to pull them out of there, and then just cleaning regularly. Okay, urinary stones. So this is a big problem in male ruminants. So it can happen in sheep, goats, and cattle. Male pigs are also prone to urinary stones. Very uncommon in male llamas, but and I would say the number one animal of all of these that I see this in is the goat, because of their diet and their genetics. So urinary stones, you can see in this goat picture here. Can you guys see my mouse?
Yeah.
Okay, so this right here is the bladder, and then this little box here is showing these stones, which are sitting in the bottom part of the bladder, obviously with gravity. And this is actually what one of the most common urinary stones look like, calcium carbonate stones. They look like little copper BBs. So these form when there's an imbalance in the diet in their calcium to phosphorus ratio, which we will throw this balance off by feeding them alfalfa, whether that's pasture alfalfa or alfalfa hay, and when we feed them grain. So it happens in a lot of goats destined for meat production, or like show goats, because those people are feeding them large amounts of grain so that they gain a lot of weight. So they develop these stones, and then the stones form, and then at some point they follow a stream of urine, and then they go down the urethra. And then this is one of the big problems, is not only is the urethra of a male very narrow, but the other problem is that ruminants, cows, sheep, and goats specifically, have what's called this sigmoid flexure in their urethra. It's this little S shape here, which creates the perfect place for these stones to get trapped. So I'd say this is the number one place where they get trapped. Sometimes if they're small enough, they make it past here. And then at the end of the penis of a male sheep or goat or cow, they have what's called this pizzle. It's this urethral process at the end. It's like a little worm at the end of a penis. Its function is that it helps spray sperm around, but it also is a really great place for trapping stones because it has an even smaller diameter than the rest of the urethra. So when this happens, there's really nothing that you can do except for surgery. So this is definitely an emergency. And even I remember in veterinary school seeing a lot of these pet goats that underwent surgery for this. And even after they undergo surgery, there are many complications associated with this surgery. So by and large, this is something that we must try to prevent. So how do we know when a male goat has a urinary blockage? I was taught in vet school, if you see, or if someone calls you about a male goat being sick, the very first thing you should ask is, when was the last time you saw that animal pee? Because this is probably the number one problem of male goats. So really any sign that a goat is acting off could be a sign that this is going on. It could look bloated. They may not be eating well. They could be showing just general signs of pain that ruminants show, which would be tail ringing. That could be a sign of abdominal pain if their tail's kind of going up and down, grinding their teeth, acting depressed, vocalizing excessively, straining. So this goat in this picture is straining to pee, but it could also be straining to poop. So you have to kind of be watching the animal closely. And that's a picture on the right of those calcium carbonate stones, what they look like. Preventing this disease is just a matter of having fresh, clean, accessible water all the time. So goats don't tend to be the best drinkers, so we just need to do whatever we can to encourage them. So putting water both inside and outside the pasture, making sure the water is cool in the summer and heated in the winter. Having free choice mineral salt available with the correct calcium to phosphorus ratio. Removing alfalfa and grain from the diet, since they both contribute to stones. And I say restrict because I think in small quantities, a little bit of grain is okay now and then for like a treat or for training when they're getting their feet trimmed, but it's just not something we want to be part of their everyday diet. It should be thought of as like a slice of chocolate cake. I think we talked about this a little bit before at one of the talks I did, but kind of ruminant digestion and how it works. And I did find a really great video online that kind of describes more in depth the process that's going on as a ruminant eats and the food goes into his stomachs. So if anyone wants that, I'm happy to share it. I didn't put it in this presentation. I just put this picture. So this shows basically the esophagus, you know, the big tube, all the food goes in, and then it goes into the stomach, which in a ruminant, that's a 4-chambered stomach. So it includes the rumen, which is the really big part, the reticulum, the omasum, and then the abomasum, which is considered the true stomach because it secretes acid to digest things, just like our stomach. And then from there to the small intestine, the large intestine, and out to the colon to poop. So I just wanted to quickly mention what happens when a ruminant is chewing their cud. So that animal picks up a large clump of hay or grass. It swallows it, so it goes down the esophagus, and then that food falls into the rumen. Then a portion of that food comes back up the esophagus, and you can actually see that happening if you watch their throat. You'll see this little blub go right back up, and then they chew it. And that's them chewing their cud. And then after they chew, then they swallow that, and then that goes from the reticulum to the omasum into the abomasum, and through the rest of the GI tract. So that's a very quick oversimplification of what's happening. And again, I'm happy to share that video if anyone's interested. Oh, and I did also want to touch on here, I think that another difference between ruminants and us is that we get our nutrients and our energy from the food that we eat, whereas a ruminant gets their energy from bugs that are in their rumen, which is why a ruminant can survive on eating straw or even newspaper. All they need is roughage to feed the microbes, all those little microorganisms that are in their rumen. Those little microorganisms, when they get that roughage and they break it down, they produce what's called volatile fatty acids, and that gives energy to the animal. So very different digestive process than what we have. Just some cool facts about cows. So cows produce 30 to 50 quarts of gas per hour in the rumen, and they release this by belching. They spend 40% of each day ruminating. So that's the same in sheep and goats. So something to watch for. A happy sheep, goat, or cow should be laying there or standing there, and it should be chewing its cud. And also cows can produce up to 40 gallons of saliva a day to add to their rumen. So a lot of saliva. And another thing about ruminants is that they don't become ruminants until after they're not nursing from their moms or from the bottle anymore. So when they're drinking milk, they're actually pretty much just the same as us as far as their anatomy or their digestive process goes. So this is actually a calf that I saw that was bloated in an externship that I did when I was in vet school. So I just wanted to touch on bloat. So basically, as I was saying, all that gas that ruminants produce every day, they have to, like, burping for them is an essential part of life. So they have to be able to burp that all up to release that gas. If for whatever reason they're filling up with air and they're not able to burp it up, they have what's called bloat. Bloat is definitely a life-threatening emergency because the problem is that the rumen will continue filling up with gas or frothy bloat. So it's kind of like frothy bubbles. It will continue filling and getting larger and larger until it's putting a significant amount of pressure on the chest, and then this animal eventually will suffocate because it won't be able to breathe. So in this picture here, this veterinarian was tubing this calf to relieve some of the gas off of the rumen. So there's two kinds of bloat: frothy bloat and free gas bloat. Frothy bloat can happen when there's sudden access to lush pasture, rich alfalfa or grain. So pretty much any sudden change in diet for a ruminant. And then what happens is that there's all these chemical changes happening in the liquid within the rumen, and then basically normal gases become entrapped within this layer of froth that forms. And then because the gas gets trapped, they're unable to release it by burping. The other kind of bloat is free gas bloat, and this is when the esophagus is blocked off by an obstruction, and this prevents burping. So that could be like food stuck in the esophagus. I put some examples up here of apples and potatoes. Those would be two common ones to get stuck right in the diameter of the esophagus. The other example of this is actually something that's happened in one of our residents, so Tito. So when Tito was younger, I don't think this has happened recently, but he used to have kind of this on again, off again, where he'd bloat up a little bit and then go back to normal. And in Tito's case, because he had, well, him and his siblings, which did not make it, all had horrendous pneumonia when they were first rescued by the sanctuary. And because of that really bad pneumonia, he has some probable really bad scarring in his lungs. And then that scarring can cause lymph node enlargement. And then the lymph nodes that are near the esophagus or near the nerve that controls digestion, when those lymph nodes are enlarged, that can also cause there to be some blockage of the esophagus, which can cause bloat. So bloat is definitely an emergency. So if anyone ever thinks that one of the animals is bloating, definitely call a vet. But the other thing that I want to stress that we do is to measure that animal, because you might be catching this animal at a moment when maybe it did just get like a little bit of gassy bloat, and then it was relieved for whatever reason, and so it might be on its way down. So I like to take some long string or measuring tape or whatever, measure that, and then come back every 30 minutes to every hour and then remeasure it just to see which direction are things going in. And then it just helps us know, do we need to get that animal loaded in a trailer and rushed up to CSU, or is this something that's getting better on its own? Clostridial diseases. So I put this on here because they are important diseases of ruminants, but they're also one of the two things that we vaccinate them for. So I think you guys have heard me talk about this vaccine before, and some of you give it to the animals yourselves, the C, D, and T vaccine. So what does this stand for? So they're all clostridial diseases. C and D are Clostridial perfringens, which is type C and D, which in layman's terms is called overeating disease. And then the T is for Clostridium tetani, which is tetanus, which we are also vaccinated for. So overeating disease is caused by Clostridium perfringens, which is a bacteria that's normally found in the intestinal tract of all ruminants. However, when there's a sudden change in the diet, so somebody's all of a sudden given like a huge bucket of grain, or maybe one of the sheep or goats were given way too much produce or something, any big change in diet, that causes this bacteria to overgrow and start releasing toxins. And those toxins cause a very sudden onset of inflammation in multiple organs and ultimately leads to death. So what you could see would be, the biggest thing is belly pain, but they're not wanting to eat. They might be acting like a colicky horse, so kicking at their stomach, getting up and down, crying out, or oftentimes, where in cases where animals are not vaccinated, what you'll see is that there's sudden death. Tetanus is a bacteria that is also normally found in our environment, in the dust that's on the animal's skin, just like on us. And when a wound occurs, this bacteria goes into the wound, multiplies like crazy, and then releases this toxin, which is what ultimately causes the disease. So clinical signs of tetanus, I think we all think of like locked jaw, stiff limbs and tail, drooling from the mouth, and eventually like rigid paralysis and death within 2 days. Johne's disease is a intestinal disease so there's a few diseases that we test animals for, a few things that we test our ruminants for when they enter the sanctuary, when they're on a quarantine before they're introduced to everybody. So we do a fecal on everyone to check them for parasites. We check them for Johne's disease, and then we check them for a viral disease called CAE, which I'll cover next. So Johne's disease is important because it's an oftentimes fatal chronic infection that affects the small intestines of ruminants. It is caused by a bacteria which is related to the same bacteria which causes tuberculosis and also leprosy. Johne's disease in ruminants may or may not be zoonotic, which means it may or may not be contagious to people. And this is one of the biggest questions out there, and it is a very controversial topic of research. But I'm sure you guys know that it's popular for people in certain areas to drink raw milk. And this is kind of one of the big reasons why not to drink raw milk, is that you could be risking getting Johne's disease, which could actually be linked to Crohn's disease. This has not been definitively proven, but it is a possibility. So an animal with Johne's disease, whether it's a cow or a goat, in the beginning, it will look like a very hungry cow or goat that is eating ravenously, but despite that is continuing to lose weight and having horrible diarrhea, which eventually leads to chronic wasting and a lot of protein loss, which causes them to have that same bottle jaw or edema that the goat with the parasites had in the beginning. And this is the other big thing that we test incoming ruminants for. So the lentiviruses, goats get what's called CAE, and sheep get what is called OPP, but they're pretty much the same virus. They're often transmitted from mother to babies. However, there can be goat to goat spread as well. This virus replicates very slowly, so it can take a really long time for this disease to become apparent, and it can manifest in many different ways depending on at what point the animal becomes infected. So it could cause arthritis. That's probably what I've seen most commonly. It can cause encephalitis, brain disease, which I've seen in kids or baby goats. It can cause mastitis, infection of the udder, and pneumonia, infection of the lungs. So I put this slide on here just to pose the question of which of these goats has CAE. And the point of this is that you might look at it and say, well, obviously the one with this, unthrifty looking hair coat, he's got, what looks to be a swollen joint right here on his knee. However, we don't know. Only 35% of animals infected with CAE show clinical signs of disease. And this is why we test incoming residents, because we want to make sure if we do bring somebody in that we know, who to house them with, so we're not infecting everybody else without knowing it. And then I've touched on arthritis in the other lectures about the pigs, but I'll just kind of go over this briefly. Ruminants are also prone to arthritis, especially our ruminants that are pets and living on the sanctuaries, just because they're living longer lives, and more so in the pet population that I see, but obesity is often a problem. So arthritis is basically a breakdown of the cartilage that acts as a cushion between two bones. And it's a very, very painful thing that happens. And it's probably the #1 cause of chronic pain in older animals. The worst thing about arthritis is that there is no treatment. It is a disease strictly of management. The #1 most important thing we can do is keep these animals at a lean body weight, so that they're having less weight and less impact on these joints. And then there's all these other alternative options listed, which we do a lot of these in our residents. Joint supplements, Adequan, which is an injection that we give a lot of the animals to increase lubrication and decrease inflammation in the joint. Acupuncture, we've done for several of the residents. Cold laser therapy, we've done massage, physical therapy, environmental enrichment to reduce inflammation and pain via the brain, pain medications, joint injections, and more. There's so many things for treating arthritis, but these are just the big things that we have done in our residents. And this is just an oversimplification of how fat acts as a pro-inflammatory organ. So I think a lot of us think of fat as just a nuisance, but a lot of people don't know that fat is actually a hormonally active tissue. And many of the hormones that are within fat are pro-inflammatory. And that's why they're associated with either worsening or leading to a lot of these diseases listed here in people. Risks associated with being overweight. Joint disease is #1. Inflammation, since fat is an inflammatory organ, and decreased lifespan. So we don't have any studies in ruminants, but there was a very large study in Labrador retrievers, which showed that the leaner Labrador retrievers lived an average of 1.8 years longer than the labs who are overweight. I didn't really go into respiratory diseases a lot, but I just wanted to touch on a couple things that we could be looking for. So nasal discharge, whether that's blood or more like goopy, snotty noses, could be a sign of trauma, pneumonia, whether it's viral pneumonia or bacterial pneumonia. Sheep are prone to a parasite called nasal bots, where they will get a parasite that goes into their nose. Watching the respiratory rates of their residents is really important, and that can tell you when an animal, may be stressed or may be having some sort of respiratory illness. And then one important thing to note is that camelids, so llamas and alpacas, are obligate nasal breathers. So it is not possible for them to breathe out of their mouth, just like a horse, which is why a rattlesnake bite or any other kind of poisonous insect bite that causes swelling to the face could be particularly dangerous, because they don't have the option to all of a sudden start breathing out of their mouth if they're having swelling over their nose. So you might see, whereas you might see a sick, stressed cow or goat pant from its mouth, what you would see in a llama would be more like flaring of its nostrils. So it's important to look for that as a sign of stress or illness. And then ruminants, or sheep and goats and cows, breathing out of their mouth. It's not normal, but it is possible that they do it. But to me, that indicates that that animal is overheating or stressed or having a respiratory illness. The normal llama, I put this picture in here of my daughter and I from last summer with some of my llama patients that live in Boulder that are pack llamas, and we went up hiking near Heil Valley Ranch, and they're awesome llamas, those boys. So the normal llama is very stoic, as you guys all know. All who know Tony know how stoic he can be, and he comes across with a very serious facade, but that's just him being his normal llama self. Llamas will tolerate being touched, but but it is very rare to meet a llama who truly loves snuggling. If they're not eating, sleeping, or sunning themselves, we all know Tony's very good at sunning himself, then they should be chewing their cud. So again, ruminants should be chewing their cud 40% of the day. They should be eager to eat when fresh hay or grain is presented. So how do you know when a llama's sick? Which is hard since they're, again, very stoic. So they'll probably be spending more time cushed, which they could be spending more time cushed because of just, they're tired, but while they're cushed, they should be chewing their cud. So if they're laying down more and they're not chewing their cud, that's a problem. And just in case anyone doesn't know what cushed is, when a llama or an alpaca cushes, that's when they lay down and how they tuck all four limbs under them. That's a normal thing that they do. And their legs should be perfectly under them. They might be foaming at the mouth or drooling. They might be getting up and down frequently, like they can't get comfortable, or they could be awkwardly cushed. So again, cushed is all four limbs perfectly under. When we're awkwardly cushed, we might have like all of our legs kicked out to one side, like our belly's uncomfortable, or we're just moving around a lot. Their eyes might be kind of glazed over or squinting. They are prone to problems with their eyes because they do have such big, prominent, beautiful eyes, but those eyes are then prone to a lot of problems. And then grinding teeth, just like in ruminants, these guys will grind their teeth when they're uncomfortable. Heat stress is one problem that we see more in llamas than in other ruminants. Again, maybe because they're obligate nasal breathers and they can't pant if they really needed to, but also probably because they come from South America and the really high elevations, which are really dry and cool. And luckily, we don't have too many problems with this in the Front Range because it's so dry, but we do have some temperatures that are very, very warm. So it is something that we need to watch for. Preventing heat stress, making sure these guys have shade or a well-ventilated barn to go into, fans in front of their stall, always, always, always having fresh water available. Some of these guys love wading pools or hosing. I have quite a few alpaca clients who will like get out the hose and all their alpacas come running for them to hose them down. I don't know if we've ever tried that with Tony, but something to consider. And then shearing, though this is a bit of an area of debate. So alpaca people routinely shear, also because they're looking to use the fleece. However, there's a lot of llama people who say that the fleece in and of itself is acting to insulate the animal. So shearing might make them more hot. Okay, just quickly touch on vital signs. So have my little heart where you're going to listen to the heart rate right behind the elbow of the animal. Sometimes you have to move it around, and in ruminants it can be hard to hear. And the star is over where we're going to listen for lung sounds, so really just right above where you listen to the heart. The little sun is where we're going to listen for rumen contractions. I know we've talked about this before with several of the care team members, but basically a rumen contraction to me sounds like waves crashing on the beach. And you should hear 1 to 2 wave crashes in a minute in a normal animal. These are normal vital parameters. You don't have to write them down because I think Chartrina will share this with everybody, but I think it's a good idea too to just now and again practice doing physical exams or listening to the heart or listening to rumen contractions, because if you know what it sounds like when everybody is happy and normal and healthy, it will be much easier when you suspect illness in any of the residents to then say, there's definitely something wrong. Normally he has, 2 really good rumen contractions a minute. I'm not hearing anything. Or I'm having a lot of trouble hearing any lung sounds, and normally I can. So I would encourage you to take your stethoscopes and listen so that you know what normal is. And then just some things that we should have in our first aid kit. Antiseptic solution, some kind of antiseptic ointment. I think you guys have silver sulfadiazine, which is much better than triple antibiotic ointment. Some kind of skin glue or super glue. And then I think having hemostats or some kind of clamp is good. Worst case, something was really badly bleeding, that you would have that ability just until myself or until you got them up to CSU, just to kind of hold off a blood vessel. Bandaging materials here. Pretty much all of this stuff we could get at Colorado Animal Health. So just a list there, don't need to write it down. And then stethoscope, exam gloves, syringes, just more things for the first aid kit. And then another reminder, just to wear your stethoscope correctly, since so often on TV, they're being put in backwards, which is not helpful for listening to anyone's heart. So make sure that the earbuds are facing forward. And then in any emergency, just remember to keep calm. So important for you, for everyone else with you, and for the animals. Yeah, above all else, keep calm. And then, if everybody's still awake, if anyone has any questions.
So with the grinding teeth,
Mm-hmm.
their teeth that get like in their own mouth, or does that count if they're grinding their teeth on like wood or different objects?
Yeah, good question. Like kind of how horses will do that like cribbing thing where they chew on like poles.
Tony does that a lot.
Who does that a lot? Oh, sorry, I can't hear.
Tony grinds his teeth a lot on the wood, like inside his home.
Okay, so tooth grinding as a sign of pain is their own teeth. So yeah, you'll hear like, well, I think you guys know what it sounds, but it doesn't sound good. What Tony's doing is more like what horses are doing, which is more of like a behavioral, either a boredom thing or he likes the taste of what he's chewing, but that's not a sign of pain.
Okay, thank you.
Yeah.
Other questions from the team?
No, I think you answered everything, Jess.
Okay, awesome. Well, if you guys think of anything later, you can email me.
Okay, so we can, and so that particular first aid kit, Jess, that you put together is for ruminant specific?
No, that's the same one as the pigs. I would say that's just our general first aid kit.
Okay, so our general first aid kit for the large lodge.
Yeah.
Okay, that's excellent. Thank you so much. For some reason, there was a glitch. So we will be sharing this. Many volunteers, for some reason, could not get on.
Oh, no.
Yeah, so I wonder if it has something to do with us being cut off in the beginning. But we will share this with everybody.
Perfect.
If the volunteers are watching this secondarily, thank you so much for watching second. If you have questions, though, about this presentation, you can contact me and we'll make sure that Jess answers your questions as well.
Perfect.
Thank you so much.
Thank you, Jess.
Thank you guys. Take care.